Hi, everyone. My name is Kate. I am a nurse educator here at Women's Health Network. And I'm so glad that you're joining us for a discussion today on a really interesting topic that I feel like we've been hearing a lot more about, the idea of being skinny fat. So here to join the conversation with me today, I have Dr. Mary James. She is a naturopathic physician, and she is joining us from North Carolina. Hi, Mary.
Hi, everybody.
Thanks for being here. And we also have Dr. Amber Hayden. She is an osteopath, and she is also joining us from North Carolina. Hi, Amber.
Hey.
All right. So I guess I'll start by just kind of getting everyone on the same page. What does it mean to be skinny fat? And what types of issues does this state put you at risk for? Mary, why don't you go ahead and start us off?
Skinny fat is basically being slender, but having the physiology and the risk factors for diabetes, cardiovascular disease, metabolic syndrome, the risk factors that an obese person has. So it really comes down to fat content in the body and especially location of the fat in the body. So a woman who is skinny fat tends to have extra fat in her belly, and that fat is very active tissue compared to, say, subcutaneous fat on the thighs or the rear end or the hips, which doesn't produce so much inflammation. The belly fat produces all these inflammatory compounds that then wreak havoc in other parts of the body and raise risks of diabetes, cardiovascular disease, increased clot risk, clot formation risk, abnormalities in your lipids, high triglycerides, low HDL cholesterol, sometimes blood pressure can go up. Metabolic syndrome, which is essentially pre-diabetes, can be the case for a lot of people who have skinny fat. And there are studies that suggest that there's a 2 times the mortality risk in people with metabolic syndrome compared to people who don't have metabolic syndrome. Mortality from all causes. So it's something to really take seriously. And a lot of slim women don't know that they have it. And actually 25% of women, or 25% of people, are skinny fat. They have no idea that they're walking around with these metabolic risk factors.
Okay. So I guess that leads right into my next question. How does someone know if they are skinny fat, if that applies to them? Amber, how would we know that?
One really easy way to look is just in the mirror, sort of what Mary was saying. You know, a woman, typically is that pear shape, but when you're starting to develop that more abdominal or central obesity is what we call it, they have more of an apple core shape. So women will have really, really thin legs and very thin arms, but they'll find that their abdominal section is a lot larger. And it could still be small in comparison with another person, but if it's in proportion to your body off, that can be a good indicator that you're actually misplacing your fat and developing that central obesity and putting yourself at higher risk. Another way to identify it too is just to look at your family and look at your mother and your grandmother and their lifestyles and what risk factors they really had in their life. Your mother might be slender as well and have had a heart attack at 45, or even have thyroid disease or high cholesterol or high blood pressure. And a lot of women will say, well, she just really loved her salt, but it's more than that. You really have to look at the reasons why your relatives are having the diseases that they're having as well.
Okay. Mary, did you have anything to add on to that?
Yeah, a little bit. I think Amber's right on about looking at whether you're pear-shaped or apple-shaped. That gets into the abdominal fat, the belly fat that I was talking about. If you can have a thick waist, but if your hips are wider, if your rear end is wider, then you may not be carrying that risk. But if your waist is too wide compared to your hips, and so the hip hip-waist ratio, the waist-hip ratio is helpful to look at, to measure both, and to make sure that your waist-hip ratio is lower than 0.8. In men, it would be 1 to 1 waist to hip. So women typically have a smaller waist than hips. So as the belly begins to get larger, the waist circumference gets larger, past 35 inches around gets to be a little worrisome, then that risk is going to be a lot higher. And the only other thing I'd add is to do kind of a self-assessment of fitness, because skinny fat women tend to have less muscle, more fat tissue, even though they're slim. So that's a pretty easy thing to assess in oneself. Just ask yourself, am I sedentary? Do I have a regular exercise program? Do I feel fit? Do I feel tired and winded after walking up a hill when I didn't used to? Do I feel kind of flabby even though I'm skinny? Those are all kind of telltale signs that you could benefit from an exercise program and increase your fitness.
Right. Also, I think right along with that, with kind of just checking in with yourself about where you are, whether if you're winded when you get to the top of the stairs, and if you're feeling a little soft. You also know what you're eating for breakfast every morning and what you're eating in front of the TV, or how much time you're in front of the TV, as opposed to other, making other healthier choices. So I think just like you're saying, kind of evaluating your total life picture, everything that you have going on, as well as what you're not doing. So yeah, I think that touches on just about everything. So if somebody looks at their diet, looks at their maybe lack of exercise, and determines, yeah, that's me. I'm that skinny fat person. What suggestions do you have for starting as the best step to get to a doctor and get some testing done, or should we start with lifestyle changes? What do you think, Amber?
So I always recommend, being a family doc, you need to always sit down and talk with your doctor and talk about your risk factors, because I think you need to understand what they are. Depending on what age you are, there are standard tests that we do just to assess your risk, and we do those because studies have shown that there is a great benefit for us doing those tests in protecting your health, catching it early, versus not doing it until that illness presents itself or the risk factors present themselves. So, for example, just checking what's called a hemoglobin A1C, which is basically your average blood sugar over the last 6 weeks in your blood, and that's a really good way for us to assess your risk for diabetes, type 2 diabetes. There's a certain number that tells us that you're in that pre-diabetic realm, that you're actually in that diabetic realm, or that maybe your blood sugars are going too low and that maybe there's something else going on. It's also standard of care to check a thyroid, as well as just your lipid, your cholesterol. Now that's a little bit different now. We do that more with women who are 45 or older. We don't check it yearly like we used to. The guidelines have changed. But just making sure you're up to date on all those preventative measures will help you just assess a baseline risk. And also just to discuss with your doctor your family risk factors as well. Also, your doctor will help you set up a plan. I think we as women are very empowered, and we can look things up and create plans on our own, but I think sometimes having that coach or that person to say, hey, this is what I think you should be doing, or yeah, you're going in the right direction, and having someone to check in with, maybe coming and seeing your doctor every even 6 months to just see how you're doing in that process is really helpful. I also encourage women to find friends who are in similar situations. They find that women will do better in fitness programs when they are with other people and they have someone to work with, like a partner, rather than doing it on their own, because then they have someone that will hold them accountable for their own health, which is really important.
Excellent. Yeah, that accountability piece is huge. Mary, did you have anything to add to that?
First, I just really agree with you, Amber, on that. You talked about the risk of, or looking at family history and how that makes the risk higher if you had a parent die of a heart attack or something. And I think that's a really good reason, especially to get in and do what Amber's suggesting, sit down and talk to the doctor and get tested, and then it's really helpful to have the support. I just wanted to add that with skinny fat, it seems like there's two major concerns or two major factors increasing risk in the body, and one is insulin resistance and the other is inflammation. That inflammation that's produced by that abdominal fat, which is really visceral fat. It's in the viscera, it's especially around the liver, and so someone who's really thin might not even notice the fat because it's so deep. But anyway, that fat produces inflammation, and then that inflammation directly produces insulin resistance. So I see two main goals in someone who has skinny fat. One is to increase insulin sensitivity, and the other is to reduce inflammation. And there's a bunch of ways to do it, but two major areas are fitness, like we touched on, and diet, like you touched on, Kate. And I think a really helpful example which can drive home the fact that the skinny fat or health and disease risk is not really about size per se, is to talk about sumo wrestlers for a second, because these guys are huge, and to maintain their weight, they eat 6,000 to 7,000 calories per day. They really pile it in, all kinds of foods, and they're fat. They're huge, but they have tons of muscle mass, and they're active all day. So they, for the most part, have very low disease risk. They have good insulin sensitivity. They're not walking time bombs for heart attacks and diabetes. But when they retire and they're still big, all of those risk markers go through the roof. Suddenly they're developing diabetes, they're developing cardiovascular disease and hypertension and all sorts of problems. So it's really not about size. It's about your muscle mass, your fitness, and nutrition. There's a lot you can do with diet and nutrition to reduce inflammation, to increase insulin sensitivity. Primarily, the biggest things are to reduce sugar, reduce simple carbohydrates, so the refined carbohydrates that break down real fast and raise your blood sugar, and to increase protein, because people who have skinny fat tend to take in inadequate protein, and they often take in high amounts of these simple carbs and sugar.
Okay, so there's a lot of stuff that we can be doing to get started, both in our own lifestyle and, as part of that healthy lifestyle, getting some testing done and just knowing where you stand in the first place. So I'm going to just skip ahead a question, because you touched on this, Mary. One of my big concerns, and really one of my pet peeves, is that we as women, and the women that we work with and the women that we know, are always concerned about their weight. And the goal always seems to be getting skinnier instead of getting healthier. So I just wanted to ask both of you kind of what you would like to say to women, and what we as providers should all be saying to women about weight loss and size and health. Amber?
So the big thing is everybody is different, and every body responds to these lifestyle changes differently. I can tell you on countless occasions, I have patients come in and say, my clothes feel skinnier, but my clothes feel looser, but I'm not losing any weight. And a lot of that because their body just has a tendency to turn to muscle rather than just becoming skinnier. And so really not focusing so much on the scale, but how you feel as a person is really important. Are those clothes fitting a little bit differently? I think that's probably your best measure of how you're doing fitness-wise, but also just generally how you feel. That is a great scale of just what you're doing and how your body is changing. If you're finding you're feeling more refreshed in the morning when you wake up, when you climb a flight of stairs, you realize, oh, I'm not sweating, I'm not short of breath. That's all great measures. and also just, are you able to to continue those modifications? Every woman should be exercising about 30 minutes a day, 5 days a week. If you're already at that goal and you feel like there's not much change there, try to increase it a little bit more. Your body just might need a little bit more exercise than the average person. But if you're feeling good and if you feel in those, you're getting things checked out and you're following a plan, just because that number on the scale may not be changing, you're actually probably making really good changes in your body. And so I often recommend to my women, really, I would stay away from weighing yourself and really just focus on how your clothes fit and how you feel as a person. Something I do in my clinic is when I'm helping a patient start a weight loss program or even just a get healthy program, is I have them put something at the top of the page that says, well, how did I feel today? Did I feel tired, sad? And it's really important because then we can look at what they did that day and if that really affected the way that that affected their mood, or are they saying they're feeling better more frequently, so that you have more gauges than simply this weight. I absolutely think we focus way too much on that scale and really not enough on what you're doing for yourself. I really love those activity trackers they have, simply because it lets you sort of quantify your hard work without that number on the scale. You say, I did 2 times my recommended steps today. I had 8 hours this week. That's all just better ways to say I am doing good things for myself, even though that scale is not saying something different.
And there are so many options for those, the activity trackers. Anybody can put an app on their phone or their tablet to keep track of that stuff. Aside from, if you need something aside from the subjective feedback. Mary, what would you say about, what do you say to the women that you work with about weight and size and health?
Well, as a society, as women in this society, we have the whole weight thing drilled into us. So it's a really hard thing to slough off. I'm wholeheartedly in agreement with Amber about putting that scale aside. The height-weight charts, in the 1990s, the World Health Organization came up with the whole body mass index concept and had you, divide your weight by your height or vice versa and come up with your body mass index, which then equated to certain disease risks associated with obesity. And so, a lot of people check, a lot of doctors, will check the height-weight chart still and say, well, you're in the right place, you're doing okay. But 25 to 30% of women who are overweight or obese actually don't have disease risk. And we talked about 25% of skinny fat women, slim women, having disease risk. So the height-weight charts are really outdated. And it's, as we talked about, it's really about fitness, the ratio of lean muscle mass to fat tissue, how you're eating, how you're feeling, like Amber was talking about. So I think that weight scales can start us off in our day feeling really crummy about ourselves, because it's all about sometimes unrealistic goals or just having a really hard time getting to a goal that we've set for ourselves. And then we check ourselves, we don't have the right number, we're not getting the feedback that we want in terms of a number, and so we feel like a failure. And then that makes us want to eat a cookie. So it's kind of a vicious cycle. So yeah, put that scale on a high shelf, put the height-weight charts aside. Think about, what makes you feel good. Something that I've started to do is get up in the morning, like at 6:30, I jump out of bed. No, I don't jump. I get out of bed, and I put on my running shoes, and I go to the big hill in my neighborhood, and I go to the bottom, and I sprint up to the top, which is 20 seconds to get up, and I do 3 of those in a row, and I'm really, really winded because I didn't do this for a while, and so I'm getting back in shape, but and then I continue walking up the bigger hill to get back to my house. And I tell you, by the time I get back and I've got my breath back, the circulation is moving, my head is clear, I feel energized, and my mood is lifted. And I feel great about what I just did. I just got up and started my day exercising instead of being a slug with my cup of coffee as usual. So I think it's helpful maybe to, if it doesn't work for everybody, but I encourage you to try getting out there, before it gets hot during the day, and doing some exercise right before you start the rest of your day, and then just pay attention to good eating and how you feel in your body, and what you're grateful for, and things to help you feel positive in life.
Excellent advice. Shifting the focus away from those numbers on the scale and more to the number of positive supports you're giving yourself. I don't think any of us can go wrong with that. So one last question, and this is really maybe not specific to a skinny fat state, but really just the general, it seems like skinny fat is about basic, that everyday health, making sure that you're doing the best you can for yourself. What types of nutritional supplements or vitamins, or what would you recommend for people who maybe identify as being skinny fat and are just trying to be a little healthier and trying to reverse that state? Is there anything specific? Why don't we start with you, Mary?
Well, diet number one. Just make sure that you're not trying to substitute a lousy diet or substitute vitamins and minerals, supplements for a lousy diet, or allowing you to eat a lousy diet and taking pills and thinking that'll do it, because it won't. But on top of a great diet, a good high quality multivitamin mineral, I think, is really helpful, just because that covers a lot of ground. Specific nutrients that help out with glucose regulation, insulin sensitivity, and inflammation would be the B vitamins, especially B3, B6, B12, folic acid. Minerals, the biggest ones would be chromium, zinc, magnesium, biotin, selenium. Antioxidants, mostly through your food, ideally, the colorful fruits and vegetables. But antioxidants really go a long way with increasing insulin sensitivity and also decreasing inflammation. So alpha-lipoic acid is an especially good one for skinny fat, because it helps to keep blood glucose, blood sugar, down to where it should be. It increases insulin sensitivity, and it's antioxidant, anti-inflammatory. But C and E and a mix of good antioxidants is really helpful. And fish oils, I think, is another almost panacea for helping in all those areas.
Okay. Amber, would you add anything to that list?
She gave a lot of my favorites. Omega-3s are fantastic. They are actually pretty well studied too in cardiovascular health. It's one of the number one vitamins or supplements I recommend. Another one that I really like is just vitamin D. A lot of women, even here in sunny Wilmington, have very low vitamin D levels, and so this sort of fatigue and lack of energy and lack of motivation to eat well and exercise may actually be keeping the vitamin D levels low. So I always check that, and a lot of times women are low in vitamin D. So a good vitamin D supplement with calcium is really important as well. But again, making sure you're getting your vitamins through your food first is the most important thing, for sure.
Excellent. So, okay, that's a pretty great list from both of you. Thank you so much. And thank you so much for being here for the conversation today. I think it's a really important topic, and I hope that it gets everybody thinking about not just how big their pants are, but really how healthy they are and how healthy they're feeling. So, so again, thank you for joining us in the conversation, and thank everybody who's watched. And be sure to check back with our YouTube channel and on the website for more Hangouts to come. Thanks so much. Have a great day, ladies.
You too. Thanks.
Thank you.